This blog post is under the mental health section, and it is concerning a brief discussion of diagnosis, clinical formulation, and treatment. So the first thing, diagnosis, a few words about that. Diagnosis is a process of figuring out what it is. Basically, you can think of it as what game am I playing in? Am I playing in a basketball game, a lacrosse, a football game, a soccer, that kind of thing. But diagnosis is also influenced by a person's education, their experience, and so it's an interpretation based on their experience and their education, their knowledge base. So just know that diagnosis is just an interpretation. Now, it's also referenced in either what they call the ICD-10, and that escapes me. I want to say International Codes of Diseases, episode 10, or the Diagnostic Statistical Manual. The last one was 5, I believe, or 5 revised. But basically, those are a description of various conditions. And so by noting what it looks like, does it look like a duck, quack like a duck, walk like a duck, it must be a duck kind of thing. And so that, like, the DSM-4 is basically that. Well, are we looking at a duck or a cow or a cat? And that's kind of how that classification works. So depending on the person's education, their experience, how often have they seen a duck, kind of thing. Now if they're a veterinarian in Manhattan, maybe they don't see too many ducks or something. So that's just what that is. So ideally, diagnosis, at least in my mind, you have things like what's called the mental status exam, which is basically like a Polaroid snapshot of today. What does this look like? Okay, maybe it's a yellow duck versus a brown duck would be tomorrow, kind of thing. So then you have the mental status. You also have the history and physical kind of things, which include historical documented kind of things, like they have perhaps a traumatic brain injury, or there's a family genetic propensity for diabetes and things like that. So you have the history, physical. That the physical can also be things like, are they currently intoxicated, or is there some medical condition such as a urinary tract infection that might be causing an elderly person to be seemingly quite psychotic or delirious. And those are two different things. So that's the history, physical. And then you also have sort of the social aspects, social class kind of context. And those questions are things like, what's their education, what's their vocation, what's their current living situation, what do they have supportive relationships, or have a history of abusive relationships, those kind of things. And then you have more of the immediate contextual things, which is basically the question, why did they come in today? What's going on in the past 2 or 3 weeks to have brought them to the point of now you're sitting there trying to figure out what's going on. So that's a jigsaw puzzle, and ideally you want that jigsaw puzzle, those things like mental status, history, physical, social things, and what's going on in the environment to bring them in today. That's like a jigsaw puzzle. So when all those pieces fit together, ideally they look like a clinical profile. Now sometimes you might not have pieces of information, or at times you may have only a few pieces of information where then you can extrapolate things. So if a person's on mood stabilizers, you could say, well, they were likely somebody at some point thought they perhaps had a bipolar, a manic depressive disorder. So basically, we're trying to, in the diagnostic piece, look at, does this clinical picture make sense and fit the profile, whether it's schizophrenia, whether it's depression, whether it's PTSD with depression, anxiety, whether it's a mood stabilizer, bipolar mania, or a generalized anxiety disorder. So those are different diagnoses with a clinical profile. So the next piece is the clinical formulation, and that's what it's called. And basically the clinical formulation is a fancy word for why is this happening today? What are the factors or the various things in a person's life that are making this acute presentation or these issues come to be. So you can kind of look at it, what are the driving forces or factors for that clinical profile or diagnosis happening. And so from, and the clinical formulation could be something from, say, a thyroid disorder. So their thyroid panel is off. And so they may come looking at, geez, I'm just so darn anxious, and life was going well until 2 months ago, and then, geez, I kind of fell off the rails, and the only thing that helped was, drinking some alcohol in the evening to kind of get my wits about me. And now I've been drinking for 3 months daily, and, my life's kind of falling apart. Well, sometimes that could be, a relapse into a drug and alcohol, issue. But it could also be from perhaps a person that has a disrupted thyroid and they're just feeling anxious, and they're using the alcohol to help them cope with the anxiety, not realizing that the underlying factor or etiology, the underlying cause, is a thyroid disorder. So in the clinical formulation, you're kind of looking at, well, what is this? Is it due to, the resurfacing of an old condition or former condition that has been treated but now has reared its head again? Is it because of stressors in a person's life? Maybe they're going through job loss, bankruptcy, divorce, homelessness, and so that's driving the clinical profile or the diagnosis. But if they had their job and didn't worry about money and their kids were doing well, you wouldn't be seeing them. So that clinical formulation then kind of teases apart, well, what should the treatment be? What is the likely best intervention that is going to stabilize them or get them back on their feet and on with their life? And so I just wanted to put that out there, because a lot of times, here's the other thing about diagnosis, is that diagnosis is used for treatment direction. Are we headed in the right field, center field, or left field? Okay. The other thing is that diagnosis in the insurance world and our current mental health system, diagnosis drives payment. So if a person wants to get covered in their insurance program, and the insurance program says these are the best practices, this is the effective treatment modality for that, that's all based on diagnosis. So that's another piece of diagnosis that sometimes folks aren't quite aware of. So diagnosis also drives this whole payment system, and subsequently gets into the pharmacology, the pharmacy, and what's Is this medication going generally prescribed and approved for these for the treatment of this condition? Or sometimes you see, docs and psychiatrists doing an off-label thing, and like for example, the current there's the ketamine there treatments that just a few years ago was unheard of, and historically ketamine was used in some of the general anesthetic kind of things because there's less side effects. But now people, if they're really wild and out of control out in the field, out in the community, and the medics roll up and the person is just going off the wall and not controllable, sometimes they'll just basically put the person down with ketamine and they'll be out, but it's relatively short acting. So in 45 minutes, an hour, the person has recovered from that. So that's the nice thing about that. But now folks are having outpatient clinics to use ketamine to treat depression and mood disorders. So things are evolving fairly quickly. The last thing I just wanted to mention about diagnosis is there can also be the unintended consequence where when a person receives a diagnosis, they kind of then feel like, oh my gosh, I am crazy. I got to take these medications. Therefore, that is evidence that I am crazy. And so it can have a stigmatizing effect. Diagnosis, subsequent treatment, subsequent, hey, I got to go in and talk to my PCP or a medical doctor or a psychiatrist, and therefore, since I'm on these medications, I am crazy. Well, that is one interpretation, but the other interpretation is, hey, I have diabetes. I got to take my insulin or whatever. Does that mean that I'm diabetic? Sure. Does that mean that I can't handle the rest of my affairs and go to work and have, be a parent and, be a great partner? No, that doesn't mean that. That means that you have this small part of your life, and generally, when you take a person's life from birth to death, and they have perhaps a year or say 6 months of depression, that's a very small window in a person's life. So that's the other side, where I've met folks and they go, oh my gosh, my life's over. I'm now diagnosed. I got to be in the hospital for a couple weeks. And I try to reframe that and say, look, most of your life, by far, 98% of your life is not going to be in the hospital. Yeah, you may have to go see a psychiatrist once every 3 months, and you take a pill and you move on with your life, and that's a very small part of your life. And so ideally, the diagnosis, figuring out what's driving the signs and symptoms, and having an effective treatment. And I just want to remind you lastly, I think by far one of the best treatments is a wellness routine. And so go and look at that. I think that's it for today. All right. Thank you.